So this presentation is about understanding digital health, and there are sort of two things that I want to do in the presentation. So firstly, give some examples to illustrate the breadth of different technologies that count as digital health, and then secondly, to narrow down and go into a little bit more detail about a project being run out of ARC West called the DECODE project. So that's looking specifically at 3 different kinds of digital technology. So to give a sense of the range of different technologies that get counted as digital health, I've borrowed a great list from this paper, which has a lovely typology of different kinds of digital health technology. You'll see that this was actually published in 2014, which might seem old, given that digital health is a fast-moving field, but actually there's a lot in here that's still highly relevant. And the fact that this is old is something I'll come back to later on in the presentation. So the first example is telehealth. So these are essentially technologies for delivering healthcare remotely, perhaps by video or by email or by some other kinds of means. For example, you might have heard of Babylon GP at Hand. That's something that clearly fits into this category. That's a tool for giving patients remote consultations with their GPs. And if you have heard of GP at Hand, then you'll be aware of some of the issues that these kinds of technology raise around how they're regulated and funded and the impact that they can have on local GP services. Another set of technologies are education and training tools. So for example, there are courses and accreditations online. So this might be things like if you're a member of research staff, then you can do things like your good clinical practice training, training in how to take informed consent. That's all delivered online. So different example again, there are lots of devices and software for diagnosis and decision making. So this can be things such as decision aids, perhaps patients complete in clinic on iPads and that sort of thing. So a whole other category of devices there. And related to that, there's another category of devices, such as cardiac monitors, insulin pumps, cochlear implants, some of which may have smart features built in, and they're the kind of more traditional medical devices that you might think about. So taking a different tack away from devices, another kind of digital health tool includes systems that patients might use for sending, receiving information, for interacting with health systems, and that can include things like patients' online access to their medical records. So there are also many technologies that allow for new ways to spread health information, so that could be blogs and videos, essentially things that contain trustworthy or accredited clinical content. A good example of that might be something like the website patient.info. At the patient end of things, there are devices and software for self-management of conditions or just for monitoring conditions. That can include